Hello, I'm Dr. Macon Singletary, your friendly North Raleigh periodontist. Welcome. Today we're going to talk about at-home maintenance. I have a previous video where I talked about the two most important parts of periodontal therapy: your periodontal maintenance appointment at the office and what you do at home. Now, just a little bit about that periodontal maintenance appointment at the office. The reason why you do that is because of the cycling of the bacteria back in your mouth. Some people get the teeth cleaned twice a year, and that's good. They don't have pockets. There's areas deeper than 3 millimeters. Those people who have areas deeper than 3 millimeters, it takes 6 to 8 weeks for the bacteria to grow back between the tooth and the gum. So some people need 3-month recalls. Some people need 4-month recalls. And if you're susceptible to gum disease and you miss those recalls, the bacteria is going to repopulate back into the pocket. So you need to stick to your periodontal maintenance appointments. But what you do at home is important. The physical removal is key to controlling gum disease. I believe in the KISS principle. Keep it simple. Now, you can use a washcloth. I'm from Durham. You can use a toothpick. If you got it sticking out of your mouth here in Raleigh, they're going to send you back to Durham. We put it in a periodontal. It looks like this. Okay? So when you're at home, the best time to do it is right before you go to bed. During your sleep, the bacteria grows unmolested, so you want to get all that bacteria off the best you can prior to going to bed. Brush first. Now, I really don't care what secrets you use, but this is a soft bristle brush, ultra soft. Ultra souple, they say on the container. I don't know why. French makes it sound better. I guess it's more official. And there's the technique that we can show you. I'm not going to go through it right now, but you can come in and we'll show you. There's an end-tuft brush. This is good for in back of the last tooth in each arch. I already showed you the periodontal aid. There's another brush called a go-between. Looks like this. This is a travel one. There's one that's on a handle similar to this that a brush fits into that you can go in between the teeth with. It gets where the floss misses. Now, the most important thing, and y'all all gonna love doing this, flossing. Now, I've got a video on Flossing 101. And it shows you how to floss, but you gotta do flossing. If you're not flossing, you're missing 50% of the plaque growth. Water pick won't get all of it. An automatic brush won't get all of it. You gotta physically manipulate the plaque off your teeth. There's no magic bullet. I don't care what toothpaste you use. The toothpaste do have value, and particularly if you got recession, and so we can talk about that. That's another topic. But the physical removal once a day is important. Now, after you eat, the bacteria grows exponentially for 30 minutes. Brush after you eat. Even if it's a scrub technique and you're doing it real quick, you gotta manipulate that bacteria, and the more that's in your mouth, the more diseased bacteria can grow. The thicker the plaque, the more disease-causing bacteria. So if you're manipulating it consistently, brush after you eat. Brush your tongue once a day. The bacteria goes from your tongue to your teeth. Between dinner and bedtime, take your time, clean them good. Think the tooth is a mirrored box and you're polishing all 5 surfaces. And if you're doing that effectively, once a day, you're good. Keep smiling.